Coffee later? Alright, catch you later, man. Alright, who have we got? Miss Jayne and Denton?
That's me.
Excelente. My name is Paul Woodman, and I will be your defense attorney. Now, I understand you may have gotten yourself into a little bit of a pickle in regards to a couple of allegations of medical negligence and lack of competence. I only see these as words designed to scare you. But I've been around the block a few times, and I can personally guarantee you the best defense money can buy. All right, let's discuss your first patient, who is named patient B for the sake of confidentiality. This elderly patient presented to you with fairly severe back pain?
That's right.
Okay, that's what I like to hear. So the patient presented with a sore back. I mean, old people, am I right? So you would agree this was the most concerning thing about the patient?
I would.
Excelente. So next I'd imagine you gave him a physical exam, checking the spine for tenderness and injury.
No.
I'm sorry, you didn't check the back of the patient with the sore back?
No.
Well, I suppose it slipped your mind, Old people have issues up the wazoo. You must have gotten distracted. Moving on, it says here you prescribed the patient some naproxen, codeine, and 28 tablets of diazepam for the pain and discomfort. Very noble, thinking into the future. I like that. So obviously, before prescribing a medication, standard procedure to attain a patient's medical and medication history.
That's right.
Okay, so you took a comprehensive medical history.
No.
So without knowing any of the allergies, drug interactions, or current medications, you prescribed 3 medications. Miss, do paramedics even have independent prescribing rights?
No, not really.
Okay, let's just move on. Patient A, more back pain? Gotta love it. I see in your notes here that the patient had been prescribed nortipitine by their GP and was taking paracetamol, ibuprofen, and codeine. There's still hope yet. But there's no mention of doses or any other anti-inflammatory medications. I think we can let that one slide. You still didn't record an accurate baseline medication history, yet you still prescribed morphine, that's a heavy hitter, and naproxen, again, without prescribing rights, support by relative prescribing guidelines or any clinical indication. Don't we see an issue here?
No.
God, their poor liver. Any follow-up advice? Any at all? Patient D, testicular pain. God, I feel that one. You treated them for a UTI, but you didn't consider, any other diagnosis, didn't investigate it, at all. A few things can happen to testicles, very few of which are very pleasant. No follow-up advice? Nothing. Patient F, eye pain, headache. Didn't record anything about vision changes, if the patient wore contact lenses, fever, swelling, none of that. Any investigation into the headache, any neck stiffness, vomiting, severity level, nothing? You prescribed antibiotics when the bacterial infection wasn't even on your differentials. No clinical indication, histology, nothing. And God forbid that I ask you if you gave follow-up advice to prevent deterioration.
No, I didn't.
I know you didn't. Patient E, shortness of breath, chest pain, and pregnant. Hello, the biggest red flags in paramedichood. 2 words pop into my head here. Can you guess what they are? PE, pulmonary embolism. It says here that you didn't investigate or record any of these potentially life-threatening symptoms, nor did you connect the dots identifying the potential for PE. Come on. So you didn't mention this as even the remotest possibility. Didn't write it in your notes at all. You agreed it was a concern. But you didn't even tell the patient? Patient C, 93 years old, did not take a medication history, observations, or give any advice on preventing further deterioration.
Jayne M. Denton chose not to attend her fitness to practice hearing. Due to her multiple egregious breaches of acceptable practices, she faces the cancellation of her registration for the significant risk she placed patients in by not identifying so-called red flag symptoms. This is further justified due to her insufficient insight into her significant departure from acceptable standards, as seen by her absenteeism from the hearing. For the multiple breaches of state and federal laws, she faces fines of up to 20 penalty units for each failure to record medical information, along with fines of 200 penalty units for each inappropriate prescription. As this audit only included 6 randomly selected cases and the cost of each penalty unit is $143.75, the fines will be significant and immense. She has opened herself up to substantial civil liability by failing to provide care widely accepted by peer professional opinion by a significant number of respected practitioners in the field as competent professional practice.